Hello and welcome to our EMS Incident Command channel. Today we will be discussing scene size up. When responding to an emergency as an EMS officer, the ability to quickly and accurately assess the scene is crucial for providing effective and efficient care. That is why the National Registry of Emergency Medical Technicians developed the Scene Size Up, a systematic approach for gathering critical information at the scene of an emergency. In this video, we will explain each step of the Scene Size Up and show you how it can help EMS providers stay safe and deliver the best and most efficient care possible. Step 1. PPE, or BSI. Step 2. Scene Safety. Step 3. Mechanism of injury or nature of illness. Step 4. Number of patients. Step 5. Additional resources needed. In this video, we will not cover C-spine consideration. Let's get into it. Personal protective equipment, or PPE, for emergency medical technicians, paramedics, and firefighters is crucial in protecting emergency responders from various hazards that they may encounter on the job. These do not only include bodily fluids, but also protective clothing, which we will go over in this video. What is PPE? PPE is personal protective equipment worn to minimize exposure to serious workplace injuries. And BSI is worn to protect against illnesses. It includes a variety of items such as gloves, eye protection, masks, respirators, typically N95 rated, gowns, foot covers, hood-style covers and protective or reflective clothing. The purpose of PPE is to protect the wearer from hazards that cannot be eliminated through engineering or administrative controls. For this, first you'll need to identify the hazards at the scene. Identifying hazards also involves being aware of environmental factors. It takes into account the specific location of the emergency incident, such as a water rescue, high-traffic roadways, or other hazards that could put EMS personnel at risk. Types of PPE. There are several types of PPE that you may need to use as an EMT, paramedic, or firefighter. Let us go through them one by one. Gloves. Gloves protect your hands from contamination and bodily fluids. Nitrile gloves are recommended because they offer the best protection against blood-borne pathogens. Eye protection. Goggles or a face shield are essential for protecting your eyes from exposure to blood and other bodily fluids. Respiratory protection. A respirator is needed when dealing with airborne pathogens or hazardous materials. An N95 mask is recommended for respiratory protection against bacterial or viral hazards. A surgical mask is recommended for stopping the spread of these and often placed on the source patient that has a cough, sneezing, runny nose or other flu-like symptoms. Protective clothing. Protective clothing includes gowns, coveralls, helmets, reflective clothing, personal flotation devices, or hazmat suits. These are used to protect your skin and clothing from contamination and you from getting injured. Make sure the clothing is appropriate for the specific hazard you are dealing with. Proper use of PPE. Now that you know the different types of PPE, it is important to know how to properly use them to keep yourself safe. Follow these steps when using PPE. Wash your hands thoroughly before putting on any PPE. Hand sanitizer is an excellent option for when proper hand washing is not available. Make sure your hands are dry or you will struggle to put on gloves. CDC protocols recommend you put on a gown first, when indicated, then a mask or N95 respirator, as appropriate, then eye protection or face shield, when indicated for splash protection. Finally, put on gloves. Make sure all PPE is fitted properly, that you have a good seal and that it covers all areas that need to be protected. Avoid touching your face while wearing PPE. Keep a mental note of all the things you have touched, like a blood pressure cuff, a stethoscope, phones or pens, so you can be sure you decontaminate those promptly. Cleaning also requires the use of basic PPE, such as gloves, surgical mask, and when splashing is possible, eye protection too. When removing PPE, take it off in the reverse order of how you put it on. Be sure to properly dispose of any contaminated PPE following your department's rules and regulations. For more information on this, you can head to the CDC website, your department and your EMS region policies and procedures. Proper maintenance and storage of PPE is important to ensure its effectiveness. Follow these guidelines. Inspect PPE before each use for signs of damage or wear. Store PPE in a clean and dry location away from direct sunlight. Follow the manufacturer's instructions for cleaning and disinfecting PPE. Replace any PPE that is damaged or worn out. Step 2. Scene safety. The second thing we need to do is make sure the scene is safe. This involves identifying any hazards, such as traffic, weather extremes, downed power lines, fire, unstable building structures, dangerous chemicals, or violent patients. It is important to make sure we have adequate resources at the scene to keep ourselves and our patients safe. Establish zones and areas. Once potential hazards have been identified, it is important to establish zones. This typically includes hot zone, warm zone, and cold zone. These are typically set up by either police or fire, depending on the type of scene. For EMS, this step includes setting up areas such as triage area, EMS staging area, treatment area, incident command post, forward command post, rapid intervention team EMS staging, EMS transport corridor, to name a few. Defining these locations early on will help maintain a level of control and organization that would be too difficult to get later during the incident. Establishing a safe zone where you can keep civilians away from the inherent dangers of an active emergency incident will help prevent bystanders from getting too close to the scene and getting injured or interfering with the response effort. Communicate effectively. Clear communication is crucial for scene safety. Make sure everyone on the scene understands their role and is aware of potential hazards. Establish a command structure and make sure everyone knows who is in charge and what their roles are. When everyone knows their role at the scene of an emergency, the better things will go. If the scene requires it, you can shuffle your resources after evaluating. Use clear and concise language to communicate with other responders, patients, and bystanders. Use appropriate equipment. Using appropriate equipment is important for maintaining scene safety and keep you and others from getting injured, as well as to provide emergency treatment immediately after patient contact. This may include personal protective equipment, a quick response bag with emergency drugs and medications, patient conveyance devices, oxygen administration equipment, and a portable cardiac monitor, per your department or EMS region policies. This also includes ensuring that your ambulance or response vehicle is parked in a safe location, away from dangers, and that you have the necessary equipment to safely enter and exit the scene. It is important to plan ahead to ensure clear means of ingress and egress for all emergency vehicles, especially ambulances. This is especially important for the Rapid Intervention Team ambulance. Ensure everyone at the scene or coming into the scene knows these areas, the direction of approach, where to go, what not to block, and what radio frequency is being used should any problems arise. Utilizing law enforcement agencies for this purpose early on is a good idea. Practice good body mechanics. Practicing good body mechanics is essential for preventing injuries on the scene. Use proper lifting techniques and avoid twisting or bending awkwardly. Communicate with your partner, come up with a plan of action together, make sure you count so you are lifting at the same time, and if any issues come up during the lift, communicate those with your partner before you or your partner get hurt. Be aware of your surroundings. Conduct a thorough, yet rapid, 360-degree assessment of the scene. Be aware that conditions change and never stop looking for risk potentials. Always staying ahead of the problem. Being aware of your surroundings is important for maintaining scene safety. Keep an eye out for potential hazards or changes in the environment. Stay alert and focused on the task at hand. Everyone is responsible for reporting existing or potential hazards at the scene of an emergency. For example, a traffic accident in the middle of an unprotected roadway, a behavioral emergency where the patient is violent and de-escalation techniques failed, a staging zone that no longer is safe, a hazmat hazard at the scene of a medical emergency, a scared or angry pet protecting their owner, and stairs or a floor that is unstable for emergency personnel to operate safely. These are just some examples of things to look for. Never take unnecessary risks that could harm you and put those that will have to come to your rescue at risk too. Be aware of your own physical limitations, your level of training, and the safety equipment at your disposal. Wearing a proper uniform will identify you as a paramedic to civilians, other first responders, law enforcement, and hospital staff. Always keep a radio on you, keep it on, and monitor the designated radio frequency for the task at hand. At times this may include multiple channels. Make sure you are familiar with how your agency's equipment works. This will be detrimental to your safety if scene conditions change and you need to make an emergency announcement or an emergency request. When entering any type of emergency scene, it is of vital importance that you enter together, stay together, and exit together. If the scene safety conditions change, there will be no time to go looking for your partner. If necessary, leave any equipment not needed to make an exit and leave anything that will slow you down or can slow down the threat. Scene safety is a continuous, full, 360-degree assessment that everyone is responsible for communicating to the incident commander, who will in turn be responsible for communicating to the rest of the team. Anyone can raise a red flag or make an emergency announcement. Step 3. Mechanism of injury or nature of illness. Next, we need to assess the mechanism of injury or nature of illness. This involves asking questions about how the injury or illness occurred, what symptoms the patient is experiencing, and what potential complications we need to be aware of. Sample is a good tool that can be used for gathering information. Signs and symptoms. Allergies. Medications. Past pertinent history. Last oral intake. Events leading to injury. Once you have determined a mechanism of injury, MOI, or a nature of illness, NOI, you can better determine what additional equipment you will need, how you will treat the patient, if you will need more help or additional resources. However, when faced with multiple patients at the scene, a rapid triage is more appropriate. Let us know in the comments if you would like to see a triage video. Step 4. Number of patients. It is important to get an accurate count of how many patients you have on the scene, requiring EMS services. Just as important is to know their triage category. We categorize them by level of acuity. The least critical patients will be color-coded as green, often referred as walking wounded. Their triage category is minor. Next up in severity will be the patients who cannot walk, do not fit a green triage category, and require quick EMS transport. This is the yellow or delayed triage category. The most critical patients will be referred to as critical or immediate or red. It is important to quickly determine how many total patients and how many patients in each category are on the scene, so you can quickly request the appropriate resources to the scene. Keep in mind, patient triage categories can change at any point during the incident. Do not leave patients waiting to be transported by EMS unattended. They can be placed in the triage or treatment area, depending on the size of the incident. Communicate your triage total number of patient count to the incident commander, EMS incident command chief, and/or dispatch. Step 5. Resources needed. We need to determine the number of patients involved. This will help us determine the appropriate level of care needed and allocate our resources effectively. This involves a quick assessment of the scene to identify all patients who may need medical attention, including those who may not be immediately visible or obvious. Providers should scan the scene for any visible patients and ask bystanders for information. In addition to assessing the number of patients, EMS providers must also determine the severity of each patient's injuries or medical conditions. If multiple patients are present, the most critical should be identified and treated first, while additional resources are requested if necessary. Accurately determining the number of patients is a critical first step in providing effective care and ensuring appropriate resources are allocated to the scene. This may involve calling for additional EMS personnel, equipment, or support from other local, state, or federal agencies. To recap, the National Registry of Emergency Medical Technicians Scene Size Up is a systematic approach for gathering critical information at the scene of an emergency. By following this systematic approach, EMS officers can quickly and accurately assess the situation, prioritize care, and allocate resources effectively. Thanks for watching. Remember to stay safe and always do a thorough scene size up to ensure the best possible outcomes. If you found this video helpful, be sure to give it a thumbs up and subscribe to our channel for more informative videos. The best way to support our EMS Incident Command channel is to like and subscribe. If you have any advice for other EMS officers out there, or if you have anything else to add to our list, please leave a note on the comments below. Thank you for all you do, and be safe out there.